Good afternoon, everyone. This is Dr. Priscilla Bowens and Dr. Kimberly Johnson Hatchett. Hello. This is MD plus DVM, where human medicine and veterinary medicine come together to have One Health discussions. And we are really we're excited today because we have a jam-packed show. We will be talking about all things vaccine related with humans, with pets, with people and pets. We have a lot to talk about there. But before we get started, one, we want to thank everyone, all of our subscribers, for coming on to YouTube and checking us out today. We also want to thank all of our sponsors, Kindred Momentum, Pet Nugget, Bowens Neurology and Neurosurgery Locum Services, the National Association of Black Veterinarians, and Hammond Animal Hospital in Hammond, Louisiana. So we want to thank everyone for coming on, and we'll get started today. And Dr. Kim, we have a couple of things going on. We always have a theme for our show. Right. Again, today is about vaccines, but we also try to stay relevant with what we're doing. Like our last episode was about back to school and what other professional moms were the choices that we have to make in terms of schooling for our children. Right. So today we want to talk about a few things. Disaster preparedness, because we just had a major hurricane come through. Actually, we had a tropical storm first.
And the hurricane.
And then the hurricane.
Right.
And then we have other severe weather going on all the time inland. And so we wanted to talk about that. And then we're also going to touch on colorectal cancer. Because MD plus DVM, along with others around the world, mourn the death of Chadwick Boseman, a phenomenal actor, known mainly for his role as King T'Challa in Black Panther, but he played so many roles and represented so many people, especially important people in the African American community in the United States, and that's just the truth. So, yeah. Dr. Kim, do you want to help me get started with our two topics before we bring in our special guest?
Well, colon cancer is something that I think is one of the top killers of African Americans. We are disproportionately represented in colon cancer deaths, and colon cancer, if found early, is absolutely treatable. So if found early, it's absolutely treatable. Now there are circumstances, and I don't know his history, but he was very young to have been diagnosed. I guess he would have been 39 when he got diagnosed. And so there are genetic reasons why someone would be predispositioned towards colon cancer. And so I don't know if that was his history or if that was going on, because he, on the outside looking in, exercised, was a vegetarian, all the things that are risk factors that would increase your risk of getting colon cancer, he did not have, except for being African American. But if you're 45 or older, 45 is the age that the American Cancer Society is saying that if you're of average risk, and go to their website, they talk about the risk factors and what makes you an average risk person, you should get your first colonoscopy. So it's going to be, I want, all of our listeners to advocate for themselves and to ask those questions to their doctor. And before we continue on, it's something that Dr. Priscilla, who's also an attorney, usually says, but these opinions are our own. And if you do have questions that you are really worried about, we want you to seek medical advice, but these are our own opinions. So anyway, but yes, back to that. Yes, 45 and older, you should think about getting, or not think about it, you should get your first colonoscopy. And, you need to know your risk. You need to know there's treatment out there. And there are things that can be done to prevent you from getting the actual diagnosis of colon cancer. So we, and life will continue on, even if you do get it. But hopefully, God willing, you get that preventative colonoscopy and you can get things treated at the time. Okay. Yeah. And I know you're from Mobile, Alabama, so disaster preparedness is near and dear to your heart.
It is. And I will say this right before we move to that, is that I have a younger sister who had precancerous polyps that had to be removed on an emergency basis.
Yes.
And she was in her early 30s when this occurred. And in addition to what Dr. Kim said, I second everything. is that you have to talk about your family history and be open and honest with what is going on. You do not want to just assume that, you know, you need to, that nothing happened in your family in terms of cancer. And even though there is an age range, like Dr. Kim said, at 45, where you generally should start, if you have history of anything, any type of cancer in your family, you need to advocate for yourself with your primary care physician and talk about these things, because you may have to get screened earlier than 45. And so I'll be 40, God willing, this October, and I will be talking to my primary care physician about getting screened for colorectal cancer sooner. So I just wanted to remind everybody of that. And I did post on our YouTube page to please go to the American Cancer Society's webpage. They have such great information about the rates of cancer in the United States. And like Dr. Kim said, colorectal cancer is one of the third leading, actually top leading causes of cancer, one of the top leading causes of cancer, as well as cancer deaths. So those are two different things. So thank you so much, Dr. Kim, for giving us that information. And I also, yes, I am a native of Mobile, Alabama, and it is, we say it's below sea level. We are one of those areas where we are prone to natural disasters such as hurricanes that come through. And as you all may know, Hurricane Laura just came through the Louisiana, Texas area, and we sent all of our thoughts and prayers out to those individuals that were affected. In the same breath, we want to remind everyone, this is something that I gave a lot of presentations in Tarrant County, Texas, when I worked for the Tarrant County Public Health Authority. It is very important that you get together and have a plan for what you will do, whether you shelter in place or whether you leave where you are. Of course, you want to listen to local authorities, but make sure you have a plan. Make sure you have supplies of food, and not just for yourself, but if you have pets, make sure you have all their information as well. Shot records, kennels, leashes, food, and some place to go. Know their veterinarian's number if you have it. So Dr. Kim and I want to really encourage you, especially if you have to shelter in place, please have a plan. Please get supplies early. Don't wait until the stores are closed, so gas stations have run out of gas. Please try to prepare, and that will help to try to prevent loss of life. So we really want to encourage that. Did you want to add anything to that, Dr.
Well, in addition to that, not just from hurricanes, but you need to have a plan from things like tornadoes. So after hurricanes come through, our area of the country usually gets the brunt of those storms that turn, they actually are tornadoes that turn into from the tropical storms. So I know my husband and I talked about what our plan of action would be if a tornado warning were to happen. Where would we go? How would we shelter? Because there's no leaving. You have to shelter in place during a tornado. And then having a plan of action of making sure we have batteries in our flashlights, making sure we have our phones charged, you know, if a storm's coming, making sure all those things, because when the power's out, the power's out. So those types of things. So things happen so fast. Tornadoes happen in the blink of an eye. And you want to have already talked out a plan with your loved ones of what to do.
Yeah, exactly. And go to websites like FEMA.gov.
Yes.
Go to disaster planning websites that are sponsored by the federal government and your local county or state public health agencies. They usually have a lot of very useful information. We're all about facts and science here. Of course, we have our own opinions, sometimes very strong opinions, which we pride ourselves on. But we want you to go to disaster.gov, FEMA.gov, go to your local websites and get more information about what you can do. And then in the midst of a pandemic, it's even more important to know where you can go if you can't shelter in place, where other places where you can go. So with that, we are going to segue into this wonderful, wonderful panel that we have about vaccines. And I will give a brief bio. So we're going to talk today about what type of vaccines for children, pediatric age, for adults, and for pets, and why they're important. we're going to bring on, as far as the vet side, a classmate of mine from undergraduate at Tuskegee University, the pride of the swift growing South. Her name is Dr. Nicole Bruno Vereen. She practices as Dr. Nicole Bruno. She is a medical director in Texas, in the Spring, Texas area. She went to Tuskegee University undergrad and then went to Cornell University for veterinary medical school. And she's been practicing veterinary medicine for about 14 or 15 years. Sometimes I try to forget how long it's been since we've been out of vet school, but she's very, very smart, very aware of the types of vaccines and protocols that she administers and that she advises others to give. And so you'll see a little bit of a link here when she talks about rabies and other vaccines as to the link between human and animal health. So she will be coming on as our special veterinarian guest.
And our MD guests are two very special women who are in family medicine. And family medicine is a sector of medicine where they take care of babies all the way up to geriatrics. So they can take care of your entire family. So they have a very vast knowledge of vaccines for pregnant moms, for babies, teenagers, and adults. So the first person is Dr. Denise Hooks Anderson. I've known her she reminded me, over 20 years. And she is in St. Louis. She is currently an associate professor at the St. Louis University, as well as the assistant dean to diversity, equity, and inclusion. So she is doing a lot in addition to practicing family medicine. She went to Jackson State, HBCU, for undergrad, and then the University of Iowa for medical school, and did residency up in Lincoln, Nebraska at Lincoln Family Med. And she brings a wealth of knowledge about, again, not just public health, but family medicine and also academic medicine. And then our other guest is Dr. Sequita Richardson, and she is a dynamic family medicine doctor in Kansas City, Missouri. She went to the University of Missouri, Kansas City to an accelerated 6-year program where you finish undergrad and medical school in 6 years. She stayed local and did family medicine with an affiliate hospital at Research, and is now currently a partner at Encompass Medical Center, where they do everything from, like I said, kids, adults, x-rays, MRIs, all types of things. So she is they are a one-stop shop at that practice. So I'm very grateful. We are both very grateful that they agreed to come on the show today and talk about vaccines. And we're looking forward to it.
And they are joining us now.
Hi.
Hello, ladies.
Hello.
Hello. Thank you so much for being here. We have Dr. Denise, who's still coming in.
Okay.
But we want to thank you guys so much. Oh, here she is. She's coming on. All right. All right. Can you see her? Says she's joining. My computer screen is showing 2 different things. So hold on. Let's see. All right. Dr. Kim, I'm going to work on that. Can you go ahead and start with my questions about vaccines?
So let's start with Dr. Nicole. So when you're thinking about getting, like, a lot of people, because of the pandemic, you said, I'm alone, I need an animal, I need a companion. What types of vaccines should they go through, from a puppy to maybe even adopting an adult dog or cat?
So it's a good question. So a lot of times when it comes to vaccinations, usually recommend vaccines based on, there's core vaccines that animals are required to get, some by law. So rabies is one of them. But there is a vaccination combination series, which we call the simple adenovirus parvovirus vaccine series, which, especially with very young puppies, it's critical that they get that vaccine series, because if they do not, they are going to be one of the more susceptible age groups of catching those diseases. And they're highly infectious, highly, catastrophic in their lives, and they can cause death. And so, especially because they're so young and they have a weakened immune system. So those are the 2 vaccinations that are considered core. But I personally find other vaccinations core because of areas that I've lived in. And I've been diagnosing and treating patients for viruses such as leptospirosis, Lyme disease. We also have bordetella and canine influenza. So sometimes I have to have those kinds of conversations with clients to really find out what lifestyle they plan on having with their pet, because some vaccinations don't make sense in all cases. And also in parts of the country that you're in. I'm from New York, and so things like Lyme and lepto are very prevalent in New York versus in Texas. I have not seen or diagnosed a Lyme disease case here. So I don't talk about Lyme to these clients, but I am stressing things like leptospirosis and the respiratory vaccinations.
So I'm curious. Now everybody saw, maybe not everybody saw, but I saw Cujo. So have you ever, there she is. Have you ever seen any animals with rabies?
I have not personally.
Okay.
Have you, Priscilla? Or Dr. Priscilla?
No, you're fine. I have not seen it, but I have participated in the procedure that you have to go through in terms of sending off a sample and a patient has been diagnosed. And I don't know. How would you say?
Not fun.
Yeah, no, it's not fun. And just in case some people know, and Dr. Nicole, correct me if I'm wrong, we have to cut the head off of a deceased pet and send it in for laboratory, diagnosis of rabies. Did you want to talk about that, Dr. Nicole?
Yeah, so unfortunately, this usually happens for animals that are not up to date on their rabies vaccination. So a lot of times I will get some resistance from clients or owners. So those are my clients or the owners of the pets. So I get resistance because they'll be like, this is an indoor cat, or my dog barely goes anywhere. It doesn't need to get rabies. But one, I have to always remind them that it's the law. Second, is that in the event that your dog or your cat bit anyone, I mean, even like somebody coming into your home, a plumber, a maintenance person, then you cannot produce a rabies certificate. Your pet, the authorities will be called. We as veterinarians have to report it to the health office, the state health department. And then usually those pets have to be quarantined. And sometimes depending on the state, it determines whether or not that pet has to be quarantined in an animal hospital, or whether or not that pet can be in an in-home situation where they're just not allowed to leave their home. But it's very strict. It's documented. The veterinarian has to do an examination at the day of the bite or within 24 hours. And then 10 days later has to do another one and then rabies vaccinate the patient. And so it's just unnecessary. It's just a lot of extra stress on top of a bite situation. And so if your pet did bite somebody, of course you're concerned about who they bit. And if you're up to date on rabies, you have to deal with that part of it. So that's another reason to really consider the vaccination, because you don't know. Animals get stressed, they get scared, and their first response sometimes is to lash out. And you have to protect yourself, and protect your family. So from lawsuits and as well as the extra things that come along with that, on the vet side.
Yeah, thank you so much there's a whole chain of events that occurs when a pet bites somebody. And a lot of people don't even understand what goes on, because we, like Dr. Nicole said, we're required by law to do all these things. And that doesn't even touch the human side, to where they might be going to their primary care physician about getting bit by a pet, and the possibility of having to get rabies vaccine injections, which I'd love to hear from our PCPs, from our MD colleagues, about if they've ever had to address that in their practice.
So I haven't had anyone particularly with that situation. We've had some close calls with maybe like possible bats in the home, where people haven't necessarily been bitten, but they've seen the bats. And so in that case, they've had to go to the ER and kind of start the rabies series just as a precaution, because rabies is one of those conditions that it's not something you can wait about.
No.
Because if you wait too long, it can be fatal.
it is fatal. It's 100% if you wait too long. Yeah, unfortunately. Dr. Sequita, have you seen anything like that?
No, same here. Just, if there's something suspicious, such as a bat in the home, basically. Generally, when I see people who have dog bites or cat bites or whatever, they usually know what dog bit them. It's usually a neighbor's dog, and they fortunately have documentation that they have been vaccinated for rabies. So I haven't been in that circumstance where it was an unknown dog or unknown pet. We didn't know the situation or the status. But yeah, don't keep that in my office. We go to the ER for that.
Bring it to the office.
Are there annual vaccines for pets that, like for humans, we have annual vaccines that we're going to talk about. Are there annual vaccines for pets?
Yes, there are. They've changed some of the protocols over the years, and some veterinarians follow the newer protocols. But a lot of our core vaccinations have gotten to a point where we can do it every 3 years once the pet has had their puppy shots, and then they get their 1 year vaccinations and those core vaccinations, and then they can go to every 3 years. But some of the other vaccinations that I spoke about, which are considered non-core, but I still think in many instances should be considered core, a lot of times those are still annual vaccinations. And in some cases, they can be every 6 months. So for instance, some of our respiratory vaccinations like Bordetella, people hear the word board and they think, oh, if my pet is boarding, that's the only reason why I need it. But they don't realize that that is actually a respiratory pathogen. That's why the vaccination is named after it. And if your pet is in contact with more dogs, if you take them to the dog park, if you go to grooming facilities, if you are just puppy daycare, because that exists now.
Yes.
Those are reasons to do that vaccination series every 6 months, because your pet is higher, susceptible to getting that respiratory virus. So I usually recommend that, but for the most part, they are annual vaccinations or every 3 years.
Okay. So I think we can transition to think about annual vaccines. We're in the midst of this pandemic with coronavirus, but the season that is here every year is upon us, and grocery stores are already lining people up to get the flu vaccine. So we were going to talk about, the adult vaccines, and then also some kid vaccines that we want to emphasize, because kids are going back to school, kids are going to college, and there's some college vaccines that, we need to discuss. But Dr. Denise and Dr. Sequita, what about the flu vaccine? Why is it so even more important this year that people get that vaccine?
So we are still in the midst of the COVID-19 pandemic. And just as a reminder, the symptoms of COVID look just like influenza. Yes. So high fever, chills, muscle aches. And so as we enter into influenza season, it will be a nightmare to have influenza on top of COVID. So if we can reduce the likelihood of someone having influenza, and let's not forget that influenza is deadly, it can be deadly as well. It can cause superimposed respiratory infections like pneumonia.
Yes.
Put people in the ICU. So that's why it's so important this year, even more so than ever, for people to make sure they get their influenza vaccine. And the vaccine is recommended for everyone aged 6 months and above.
Yes.
So this whole type of movement of people who are anti-vaccines, we really need to rethink that because this season, getting that vaccine will be extremely important.
Yeah. Dr. Sequita, did you want to weigh in on that? And then
something that I want to weigh in on is that just some of the things that people are concerned about when they say they don't want to get their influenza vaccination. Oh, every time I get a flu shot, I get the flu. Well, there's a few things to consider. Is that a lot of times when you get the flu shot, you're either in a doctor's office or you're somewhere where there are probably sick people. So you probably were coming down with the upper respiratory tract infection anyway, and then you happen to get some type of symptoms at the same time that you got the flu shot. So that would be more of a coincidental thing. And also because of the way that the vaccine is made, sometimes because our immune response is to build antibodies to that. Sometimes we do get a little achy or that type of thing from getting the vaccination, but still that's not a contraindication. It doesn't mean that you're allergic. I still highly recommend that you get that flu shot. Other things to consider is, oh, the flu shot didn't work last year, or it wasn't very effective last year, so should I get it this year? We do know that there are studies that show that even if you get an influenza vaccination and it wasn't as effective as we expected it to be, you're still going to be at decreased risk of getting some of the things like Dr. Denise talked about. So the pneumonias and the hospitalizations that come about because of not having that immunization. So
Mhm.
and the last thing I wanted to speak on is that sometimes people say, well, oh, I got it last year, so do I really need to get this year because I don't think it was very helpful. It does seem to be a cumulative effect of getting the immunization year after year after year. In the long run, seems to help prevent morbidity and mortality from influenza on a yearly basis. So there are several things to consider about getting the flu shot and continuing to get it annually.
Now, if you're pregnant, should you get the flu shot?
Absolutely.
Yes.
Okay.
Yeah.
Okay.
I just wanted to, for some of our viewers who aren't familiar with some of the medical terms, when we say morbidity and mortality, we're talking about the incidence or the likelihood of you getting a disease, getting sick with a disease. Morbidity, and then mortality is the likelihood of death from the disease. So we're trying to encourage everyone to consider. We strongly recommend, again, these are our personal opinions, personal health care, medical opinions. And just so you know, as far as veterinarians, we actually take an oath to public health as well when we get our degrees. So this is just as important for us because of the connectedness between human and animal health. Like, we don't want our human clients coming in with the flu while they're trying to get their patients seen, and while we're having a little less contact because of the pandemic that we're in. That all affects the entire ecosystem. So we encourage that as well. I don't believe it's required on the veterinary side for staff members to get the vaccine. Dr. Nicole, are you aware of that at all?
We're not required, but I do get the flu vaccination every year. I am immunocompromised, so I do get it for those reasons and more. But yeah, I encourage my staff to get it as well.
Yeah.
I can't force it.
Yeah, we can't force it, but we agree with the medical professionals here. The years that I have gotten the flu vaccine, but have still gotten diagnosed with the flu, my symptoms have been considerably less than maybe the year that I didn't get it, for forgetting, not because I didn't want to get it, but we definitely encourage it, especially those people that have kids, and especially if they're going back to school.
Yes.
My kids usually have had illnesses and have given them nicely given them to me. So we just strongly encourage you to listen to these the medical professionals here. They're telling you the facts. We also need to address kind of the elephant in the room as individuals, as women who identify with the Black community in the United States. We know there can be some apprehension about people getting vaccinations. Dr. Nicole and I actually went to Tuskegee University, where they performed in the community, performed the syphilis study for, I want to say 30 or 40 years. They performed the study on African-American men. Unbeknownst to them, they were actually given the disease syphilis. And I'll have our medical colleagues explain what that is. It's usually a disease that's transmitted sexually. Am I correct by saying that? Okay, I'll let y'all speak on it. But there has been a lot of mistrust, not just with the syphilis study, but you can even trace back even further in the African-American community about experiments being done on African-Americans by the federal government, by people that should be trusted, by doctors that should be trusted with your health. And so we want to acknowledge that and say we know that there's a concern, but please believe we are not speaking and giving this advice just willy-nilly. Like, this is based on these are trained professionals. These medical doctors on here are trained professionals, and they empathize with that concern. And docs, you guys are more than welcome to weigh in on how you may address that in your practices.
So I acknowledge it. So the Tuskegee experiment was a public health experiment where they wanted to see the different stages of syphilis in these men. And even when penicillin came into the scene and was developed, and they knew that penicillin was a treatment for syphilis, they still decided not to treat these men. And the study actually did not end until the 70s. And it ended because of an expose, not from the goodness of their hearts, but it was because they were exposed. So absolutely, there have been atrocities in medicine at the hands of medical professionals. I mean, I actually teach on this, I lecture on this, but this is why it's important for all people, not just Black people, to have a health professional that they trust. You need someone that you trust. You also need to read for yourself because, I mean, you are part of the team. The patient is part of the team. The doctor is just one part of the team. And so, yes, we have to always be vigilant about some of the atrocities that have happened in healthcare. However, we also have to be open to that if we as people of color don't participate in research studies, that we have people producing medicines and treatments that we don't know if they're going to work for Black people. So it's a two-edged sword.
Yes.
So we have to be vigilant to make sure that this is an ethical study. And since that syphilis experiment, definitely there have been some safeguards put in place, some mechanisms where people are not as free to be so cruel in experiments and research. So there are safeguards in place now. So that's different than from those days of the Tuskegee experiment. But again, I think the bottom line is you need a healthcare professional that you trust. You also need to be able to read for yourself. You can go to cdc.gov.
Yes.
And which is a very reputable site so that you can read about the recommended vaccines for all ages.
And I mean, the CDC makes it pretty easy because they have a like a chart. They have all these charts that are in there, and they have an adult chart, age 19 and older, and they break it down for what vaccines you're supposed to get. If you know your vaccine history, if you don't know your history, and it's color coded, it's perfect. So, and it really kind of gives you the information in a non-biased scientific way. And, you know, like Dr. Denise said, you are part of the team when you're talking to your physician and your healthcare community. But you have to, I want to emphasize that you advocate for yourself. If you have the information and it's from a site like the CDC, you know, not some mom and pop website, but, you know, cold water cures, you know, those types of things. But, you know, an actual site like the CDC, you want to arm yourself with that information when you're talking to your physician, and make sure that, you know, they're hearing you, because sometimes we're humans too. And I've had patients ask me questions and I'll have to stop and say, wait a minute, what'd you ask me? And I come back and really, really focus in on what they're saying, because our minds kind of sometimes get off focus as well. So Dr. Sequita, what do you think?
I agree with both of you. You know, just like when people sign letters, they say sincerely. At the end of a letter I send to a patient, I say, thank you for allowing me to participate in your care, because it's a team. So work with your healthcare provider and say, hey, this is what I'm concerned about. This is why I don't want to get a flu shot. This is why whatever, and have a dialogue, be open to what they have to present to you, because sometimes things do sound good on Facebook or whatever, but let us be able to tell you, you know, that Facebook thing is not really, you know, on point. And this is the reason why I am saying that this would be best for you. In the end, you know, you are the steward of your body, but let us make decisions together and be open to hearing the evidence.
Well, another thing that I say to my patients oftentimes is that you're the quarterback of your team. I'm the offensive lineman coach. So I'm providing you some recommendations, that I think would be good plays. But at the end, when you're on the field, that you're gonna call the play that you think is best for you. All I can do is just make some recommendations. The other thing I often tell them is that, you know, you want to be careful from getting medical advice from your cousin Pookie. You know, cousin Pookie didn't go to medical school.
Right?
There it is.
So you really want to be careful from taking his advice.
I love that football analogy, by the way, because I'm
Yeah.
a total sports nut. I think everybody's
I
not.
use that.
I like
I'm gonna
that.
use it too.
I like that. I like
That's
that.
a Denise Hooks Anderson quotable. I'm gonna say, and I quote.
Yeah,
I have a few quotables from you that I've kept over the years. So,
No,
yeah.
that's a great
Not for this
analogy.
forum, though. Not for
No,
this
it's not for
forum.
this form. No, no. But they are good quotables, and I do say them in practice.
Okay, yeah, that's the after talk, the girl talk after the show, the after show. I will say this, and Dr. Nicole could second me or not, but it's interesting because when I practice, I mean, I'm currently a practicing attorney, but I practiced for several years, emergency medicine and small animal practice. Veterinary clients usually don't have a problem telling us what they think about what their pet should do and what their pet should get. So the same energy that you have for your veterinarian, if you have pets, please keep that same energy with your healthcare providers, as these doctors have said. Dr. Nicole, did you want to weigh in about the communication?
I've never given the quarterback analogy, but I have definitely been in situations where I try to explain to clients that, you know, I'm not just trying to throw vaccinations or sell them to you for your pet, because they read all kinds of things. And then there's always breeders that tell them that this vaccination is going to cause immediate death, you know, and they'll come in with, you know, signed statements from the breeder that they are not going to do these vaccinations because they signed it even after they paid that breeder money. I'm like, this is your dog. You can decide what you want to do with your dog now. But it definitely is a lot of education, a lot of, you know, communication and trust. You know, I have a lot of clients that, you know, used to be very adamant about not doing certain vaccinations, but because we've built a relationship and they trust me, they know that I would not, I always tell them, I don't do anything with your pets that I wouldn't do with my own. So if we can build that trust, then usually that at least breaks the ice and allows for the necessary vaccinations that their pet really needs.
Yeah, good point.
And so, you know, with vaccinations, sometimes you're thinking about preventing like communicable diseases, but there are also some more controversial vaccines on the human side that can prevent even things like cancer. So I know that you all, both being family medicine doctors, you deal with adolescents and young adults, and the HPV vaccine is out there, and it is certain strands of HPV, human papillomavirus, can cause cervical cancer in girls and testicular cancer in boys, penile cancer in young men. So yeah, so can you all kind of speak to that? Because I know that's more controversial in why you would get it, but what is the importance of why you should or should not?
Well, I think it's controversial because we did ourselves a disservice as healthcare providers by how we marketed it. So we should have utilized the words that this is a cancer preventing vaccine, because that's what it is. Preventing oropharyngeal cancers and cervical cancer, so anal cancer. So we should have said it's a cancer preventing vaccine. Whenever you put the word, use the word sex in anything dealing with something that you're dealing with children and teens, there's an immediate block from parents, because those parents automatically feel that not my little innocent Susie, not my little innocent Jane, we don't have to talk about this because they're never going to have sex. Okay. So, you know, whenever you introduce the word sex in the conversation, there's an immediate block. Because what happened, the parents started to say that, oh, if you give this vaccine, you're telling my daughter or my son that they need to go out and have sex. And that's totally not what we're saying. The vaccine prevents cancer. And it's important that boys and girls get the vaccine starting as a young tween. so that, you know, they can prevent this cancer, so that we can have less HPV virus in the community.
Because the diagnosis of cervical cancer is not in their teenage years. It's more so in their 30s, 40s, and 50s is when people are actually getting the actual cancer. So it's been lying dormant. It's kind of like we're going to talk about the shingles vaccine. Why those of us who are older than, you know, the 1980 folks who got that nice little chickenpox vaccine, those of us who did not get the chickenpox vaccine, why we need to get the shingles vaccine. But it's something that you're preventing years from now your child from getting cancer. That's the hope that by giving them this vaccine now.
But I do want to say, though, now the shingles vaccine is recommended for everyone, regardless of whether or not you can remember if you had chickenpox or not. So because everyone at this point has been exposed, so it's recommended for every person. But again, getting back to that HPV vaccine, again, we just, unfortunately, we marketed that entirely wrong. And so, I mean, we're now having to go back and really try to educate these parents. Like, I mean, I just had one a week ago. The daughter got one of the series, but the mother refused the next one. And, you know, just frankly refused it. Just said, I don't want her to have it. And when you try to ask questions, or, you know, I often say, is there something that I can answer for you? Is there something that I can explain about it? But there's just a barrier.
And this is a very real conversation that's being had in a lot of communities, especially, of course, with moms, even though I know males are the ones that transmit this. Is that correct? Are they?
It can be vice versa, because I mean, it's
way.
sexually transmitted.
But are they usually carriers, and it's really not? Can you explain that a little bit more? And then I'll go into why the discussions that I have had with some of my girlfriends.
Well, I mean, I guess how I would explain it is that it's sexually transmitted. So, and it's hard for people to kind of, like, I just kind of had this conversation last week with a woman whose pap smear came back positive. And this woman is in her 60s. And pap smear previously was normal, but this next pap smear 3 years later was, the pap smear itself was normal, but she was HPV positive. And she was highly upset because she was recently married. And so now she's blaming this new husband that she has HPV. But you really cannot say that it was the husband unless this woman could say, I've never had unprotected sex before. Because these viruses, as Dr. Kim was explaining, can be dormant, can be in your system a long time, but not manifest itself. So it took me a while to try to explain to her that you really can't, you know, point your finger at this new husband, because it, you know, you could have had this virus a long time.
Yeah, and that's what it really boils down to, is getting comfortable having these conversations with your health professional. Because I was having this conversation with Dr. Kim and Dr. Sequita the other day, talking about my level of comfort. And I'm not opposed to the vaccine, just talking about the age, you know, when I as a parent would be comfortable having my girls, you know, get the vaccine. So this is a very real conversation, but I don't think we have enough of these conversations, because I am a person who's open, one, as a health professional, I'm open to hearing the science behind, looking at the data, looking at the statistics, but as a parent, knowing of how this disease is transmitted, not necessarily thinking like my kids are, you know, they're always going to be innocent angels. Now that's definitely not, you know, I'm not naive, but just, you know, just thinking about when I would be comfortable, you know, with them starting the series, and whether they would have to get 2 vaccines as opposed to 3. We need to have more of these conversations. Like, we have to start talking about it. And this is a good start. Because it's got me, you know, thinking more and having these conversations with girlfriends who some are in the health profession, and some are just moms, and some are single women who have thoughts on this. And so we have to start talking to one another about these types of things because cervical cancer is real. So we need to make sure we're talking about this. And I know we don't want to spend all the time on it, but it is I think it's a very good conversation.
So Dr. Priscilla, too, after we talked yesterday, I did look up another study because you were asking about the numbers. So right now, today, if we gave every 12-year-old girl her Gardasil series, we would prevent 200,000 cases of HPV, 100,000 cases of abnormal PAPs. In the future, in that cohort, there would be 3,300 people that did not get cervical cancer. They got there. So when you think about that, maybe as a number and thinking, okay, that's the cervical cancer in the future, then maybe this is an immunization that people would consider.
And can I just jump in and say that, I've done mission trips to Africa before, and where the poor ladies there don't have access to vaccines. And so you have in a country like Malawi, where women die of cervical cancer, like in their 20s and 30s. So people don't think a lot about cervical cancer anymore because we've just done such a great job in this country by doing pap smears. But in that country, the women are dying in their 20s and 30s from cervical cancer because they don't have access to pap smears and they don't have access to the HPV vaccine.
Right. And again, it's not just girls, it is boys that can be, you get anal cancers, penile cancers, and oral cancers as well. So
I mean, when we talk about, go ahead.
Dr. Nicole was gonna weigh in.
Oh, I just wanted to know what is the recommended age for the vaccination to be started? Just because I have a daughter and a son, so I'm curious.
So 11 to 12, it's like 11 to 12 to age 26 when it was initially approved. And now Dr. Denise goes to 45 now, I believe.
It is, but a lot of the insurance companies though have not jumped on board. So if you're older than 26, you'll have to really call your insurance company to see if they're going to cover it. But yes.
So
see, we learned a lot on this show, don't we, about human and animal health.
So, I mean, when you're thinking about preventing things where kids are going back to school, I have two nephews that have started college. And Dr. Denise and Dr. Sequita have college age kids. So what vaccines should we be thinking about making sure our kids have had before they head off to school? Some of our kids are still in college, face-to-face, going to, dorms and all that stuff. So what's out there that we should be thinking about?
I know that before my daughter could even move into the dorm, they made sure that she had the meningitis B vaccination. There's Menactra, which you start at age, there's a series of 2. And then meningitis B, we start usually at 17 or 18. I usually give those right before you're gonna go off to college. So she had to have both of those. The Gardasil was not required, but was recommended. And we'll make sure she'll get her influenza as well here in the next few weeks.
So,
and then all the routine stuff.
You want to move to what about the older?
But Dr. Denise, you mentioned that for the shingles vaccine, shingles is a late manifestation of chickenpox. And so like growing up, I'm in my, my 40s, when my neighbor kid friend got chickenpox, my parents were like, going over there so you can get it and get it over with. And so all of us, I remember my whole class, like all of us, it kind of went through all of us got chickenpox and we got it over with. But you don't realize that you're actually setting yourself up for shingles years later. And you do hear about people in their 30s and 40s getting shingles. And I thought this was something for older people. But what were you saying, Dr. Denise, about how old you're supposed to be to get the shingles vaccine?
So the vaccine is indicated down to age 50. And so starting at age 50, you can start to get that vaccine. And the one that they recommend now is called Shingrix. It's one of 2. You get one, like say today, and you get the other in about 6 months.
Okay.
And Again, it's recommended for everyone. And the thing about shingles is that it's not just the rash. You know, it's not just this horrible rash that you see on a certain aspect of your body. It's when that rash goes away, because you can be left with some very debilitating chronic, what we call like neuro pain or nerve pain.
Neuropathic pain.
So that's why it's so important. I didn't want to say neuropathic, Dr. Kim. It's such a big word. Dr. Neurology.
You can always say it and then explain it. We want to.
So I mean, but neuropathic.
I'm a health writer, so I write it. I say it in easy words.
Right.
So yes, neuropathic nerve pain is what that means, and so that pain can be debilitating, and
Yes.
it can last forever. I mean, it can last a very long time. I've actually had shingles before, and because I'm immunocompromised, like my fellow colleague here, and you know, it was not nice. I mean, it starts out as like, it may start out like an itchy rash, and you know, you just may keep going back to that area like, what is this? What is this? And then finally it developed into this kind of painful blistery rash. And then even when the rash went away, every so often I would get this kind of shock-like pain in that area. And that lasted for a few years. But I mean, the rash can get on your face, it can get in your eyes, which could cause blindness, it could get in your ears. So it can be a horrible situation. So that's why the vaccine is recommended.
Because you don't know where, because what happens when you get chickenpox is that it lies after you have a virus. Viruses are always with you. Once you've had it, it kind of, and your body knows how to fight it. But the chickenpox virus lies dormant in a part of your spinal cord. And so it can be from the very top of your spinal cord all the way down. And it can even be in certain nerve bodies that affect your face. So you don't know if you're one of the unlucky ones who had the virus lie dormant in a part of your face. And then like Dr. Denise said, it could affect this derm. It's called a dermatome. So different areas of your body are controlled by different nerves in your body and different nerves in your spinal cord. So if you unluckily had the virus lie dormant back here, it could be right here that you get it. And so your forehead, your eye, your eyelid, all of that hairline, hair area could be affected, right? And that could cause, like she said, blindness. If unluckily you have it here, it could cause hearing loss, or not hearing loss, but excruciatingly loud hearing, because it causes these bones that are in your ear that allow your eardrum to close and open. It just leaves it open. And so everything's really loud on that one side where you've had the virus. So that's why, you know, when I see patients and I'm seeing them for something besides, you know, I'm not seeing them for shingles, I'm seeing them for diabetic nerve pain or for other nerve pain, I make sure, hey, have you gotten your shingles vaccine? Because I don't want them to be one of the unlucky ones, because even if you have it down on your torso or on your leg, it's still painful. It's still something that you don't want to have to deal with. So, okay.
They don't explain all of that on the pharmaceutical commercials for shingles. All I remember is seeing rash and pain, but that graphic depiction is very meaningful. I know the look on my face when I was listening to.
No, I had to stop because I looked at myself on the camera and I'm like, oh, this is horrible.
Yeah, because we don't
I
have
put
any
it in my planner at age 50.
Right. Yeah, 50 shingles. Yes, thank you. But yes, we don't, Dr. Nicole, you can speak to this. There aren't any conditions that I know of that manifest later in life in terms of pets. And actually the good thing about having older pets is they generally don't have to have a lot of vaccines given. It's really a lot in the younger ages where we see a lot of conditions like parvovirus, which kills puppies or dogs under 2 all the time. And can you speak to that, please, for the audience? Because I know that's a big deal on the vet side.
Parvovirus itself? Yeah, so parvovirus is probably the most common infectious disease that I ended up treating, because there is that distemper and parvovirus combination vaccination, but I've had some personal experience with distemper. My dog had distemper as a puppy. But in general, throughout my career, I've treated much more parvo, and actually parvo is one of the reasons why I wanted to become a vet, because I watched a puppy die from it, and it was just so tragic. It's tragic because we have vaccinations. And so, you know, when we see these puppies, most of the time the history is either they're unvaccinated, never received a vaccination ever, or they've been in an environment where they're at a higher risk. So rescue puppies. So it is important, even for, we talked about it earlier, people are taking in, adopting pets more, but if they're adopting them from humane societies or rescue organizations where these puppies have been in close contact with each other, they're usually very stressed out being in those situations, and that weakens their already compromised immune system. And if they're unvaccinated or just recently vaccinated, that kind of pushes them over the edge. And so they usually present for vomiting, diarrhea, they're inappetent, so they are extremely dehydrated. And because there is no antidote, there's no drug that we can give them, we have to support them through that. And, you know, unfortunately in our world, you know, money drives costs, you know, drives treatment. I'm not saying it doesn't for you, but we have insurance more for humans, and, you know, we don't turn people away necessarily. Whereas in our world, we have to actually try to find a way to treat these animals and also allow these owners to pay their rent or their mortgage. And so sometimes we end up, unfortunately, euthanizing pets because they are too sick to treat. Or owners cannot afford the type of care that they usually need, which sometimes is 4 to 5 days in the hospital, which is a significant price for people that are unexpected, you know, that don't have that money. But for the pets that we can get them through, you know, it's very rewarding, but it's emotionally tolling. But we usually have to, they lose their white blood cell count, their white blood cells are affected. And then they lose, the virus attacks rapidly dividing cells. So your white blood cells and your GI cells, which is why they are vomiting and having diarrhea, and they have low albumin. And so all this to say, please vaccinate your pets against parvovirus, because it's just the kind of disease that when I see it and I diagnose it, I just close my eyes, because it's so preventable. And the vaccination in relation to what it would cost to treat the pet is so, you know, so minuscule, you know. So please do that. You can get parvo vaccinations as early as 6 weeks of age. And we usually do vaccinations every 3 to 4 weeks. And you can do them as early as 2 to 4 weeks until the pet is about 16 to 18 weeks of age. So depending on how young they are when you start, they can get anywhere from 3 to 4 vaccination series. But that is what would be my take home message, because I see and diagnose that the most in my, for young puppies.
Okay. And so like 6 weeks, we're going to say 6 weeks and 6 months, because I know that for the flu vaccine, Dr. Denise, Dr. Sequita, you guys mentioned 6 months is when you can start getting the flu vaccine on an annual basis, all the way up until, right? And
the good Lord calls you home.
Until the good Lord calls you home. That's right. And so we talked about vaccines, and we started off talking about colon cancer. And because of what, you know, all of us know about Chadwick Boseman passing away here recently from stage 4 colon cancer. And, you know, when I kind of surveyed some of my friends about getting a colonoscopy, some had, some hadn't. What are your thoughts on screening and looking at your average risk of screening for that?
And we'll close with that.
And we'll close with that, yeah.
So again, getting back to having a healthcare home. So if you have a primary care provider, hopefully your primary care provider is following the USPTSF guidelines for healthcare. And that means that every year of your life, they kind of look at you and pair that up with the guidelines to see where you are and what recommendations are there for you at that time. So it's now recommended for African Americans to start getting colonoscopy or colon cancer screening starting at age 45. There are different ways to do it. Colonoscopy is the gold standard.
Yes.
For those persons who are just adamantly opposed to colonoscopies, there's the Cologuard, which is a DNA type test where you can just send in a stool sample. However, the caveat to that is if you send the stool sample in and your Cologuard is positive, you still need a colonoscopy. So again, if you're African American, you need to be talking to your doctor about getting a colonoscopy earlier than 50. 50 was the standard age, but again, if you're African Americans have increased risk, you should start at 45. Also looking at your diet, high fat diets, diets that are heavy in red meat, those persons have increased risk of colon cancer.
Smoking as well?
Mm-hmm.
Okay.
Yeah, please do as has been recommended by our health professionals with regards to getting screened for colon cancer. We talked about also going on to the American Cancer Society's website. There are a lot of great websites out there in terms of that. In terms of your pets, please talk to your veterinarian. There are legal vaccine, like by law, you have to get rabies vaccine. So, and that's for protection of not only pets, but people too. That's probably one of the only vaccines I want to say in the world like that you have to do that by law. Like that's a requirement. It's a really big deal on the vet side, but it protects human health as well. And just, we always have recommended sites, Dr. Kim, cdc.gov. Please go ahead. There's great human and animal health information there as well, because we know that's our predominant public health authority, National Public Health Authority, but please also go to your local, state, and government authorities, health authorities too, because that information is likely more specific to your community needs. So we thank you doctors so much for joining us, Dr. Nicole, Dr. Sequita, and Dr. Denise. Thank you so much for joining us on MD plus DVM. We always have great conversations here. We couldn't have done it without you. And we look forward to having discussions in the future. Dr. Kim, you want to close us out?
So we are really, again, thankful for the three of you guys coming out today and talking about all these important topics. We're not going to do the t-shirts. I actually have on my Wakanda t-shirt today. You have your t-shirt, you have a t-shirt on, but I want to, and oh, we got t-shirts. So I mean, do we have time? Oh, it was after 5 o'clock, but we could do this as the after show, talking about our t-shirts.
Yeah, the after show if they want to hang on.
But it's important. So guys, MD plus DVM, I hope that you all enjoyed this show. If you enjoyed it, please, join our Facebook page, our Instagram page, and also subscribe to our channel on YouTube. And all of the episodes are still available on YouTube. They will be there for perpetuity. So we can, I love that word, perpetuity. So that means forever and ever. So anyway, sorry. But yeah, so just join us every other Sunday. We're here at 4 o'clock talking about One Health, human health, animal health, and all of us being here on this planet together. So with that, we will say good evening, good afternoon, goodbye. Goodbye.
Bye.
Bye.